Good morning. We're here at my surgical center in Quezon Avenue. We're going to treat keloid on the earlobe. This is quite common. To manage this, you have to first reduce the activity of the keloid by injecting triamcinolone acetonide. It's a steroid, but it is localized. But before you do that, you have to anesthetize the area. You block the nerve so that there's no pain. Okay? And then after you do that every 2 weeks for about 4 sessions, and then after that we can excise the keloid and reconstruct the earlobe. This is 1% lidocaine with epinephrine solution. We block the posterior branch of the greater auricular nerve. So this is where to block the nerve. So I'm using a gauge 30 needle on a 1 cc syringe, and the key is rapid entry of the needle, okay, and then slow injection of the lidocaine solution, so that the patient barely feels any pain. It innervates or gives sensation to the lower half of the ear. The steroid solution is viscous or thick and it's painful. So before you inject intralesional steroid, you first block the nerve so that there's no pain. After that, you massage the area, thin the area with povidone iodine solution. Start at the base of the lesion. Okay, to control the activity, you inject around the lesion. It's the junction between the normal and the abnormal. So it's in the periphery that you inject your triamcinolone or steroid solution. After that, you go into the base of the lesion deeper. So a total of 5 cc of triamcinolone acetonide. Okay, so after that, apply pressure for 5 minutes. Okay. We're now at the surgical center, and we have a case of a keloid on the left earlobe. And we're going to now do the excision of the keloid and reconstruct the earlobe, okay, under nerve blocks. We're going to anesthetize this area, and this is innervated by the posterior branch of the greater auricular nerve and the anterior branch of the greater auricular nerve. This is your mastoid, okay. This is your clavicle, okay. This is the posterior border of your sternocleidomastoid muscle, which is inserted into the mastoid, okay. Then the nerve is approximately 6.5 cm from the external auditory meatus, so it's approximately here, okay. So the greater auricular nerve comes out in here, giving a branch, posterior branch there, and giving an anterior branch there, okay. So we start with the posterior branch of the greater auricular nerve. Your direction is just inferior to the external auditory meatus. Now we're going for the anterior branch of the greater auricular nerve. After blocking the posterior branch and the anterior branch of the greater auricular nerve, we're now going to do local infiltration to minimize the bleeding. We start the incision posteriorly. Then we make the anterior incision. Make sure you give an allowance. Don't overdo it. Okay, it's better to be on the excess side than on the side that you are lacking of tissue. Your goal is to reduce the size, and then you can adjust later. Hide the scar at the posterior side of your earlobe. Approximately 1.8, and from here it's 3.4. Should be 3, okay, 3.4. Okay, dito 1.8. Ang galing. Was it painful?
No po.
Great. Okay, we're done. This is the finished product. Okay, the earlobe was reconstructed. Okay, and comparing it to the other side. Okay, I'm Dr. Jim Sanchez of the hospital on Beach.